in the Palmetto State. The past few years of the pandemic have been hard on nearly all of us, including our children. Between virtual learning and changing mask mandates, daily routines have been constantly changing. Now, South Carolina leaders are looking for new ways to help our kids. Wake Up Charlotte's Richard Devane joins us live in South Carolina this morning. And Richard, what are the big changes state leaders are looking to make here?
Yeah, good morning, Sarah. Good Wednesday morning. Basically, health leaders in this state say there is a lot that needs to be done for children, especially school-age children. And as far as the state, we're not doing enough.
There is a mental health crisis in America, and a new report from the South Carolina Department of Health and Human Services shows that the Palmetto State has a failing grade when it comes to school-age children. Coming out of the pandemic, schools are faced with more than trying to make up for lost time in the classroom. Most are now facing new mental health behavioral issues that children are dealing with and that school teachers and counselors can help them with. But DHEC says there aren't enough counselors to cover even half of the schools in the state, leaving many with heavy caseloads and not enough time to get to those students who are in desperate need. DHEC says it's important for the state to hire more counselors to help deal with the issue. The report also recommends that it would be best if the counselors are credentialed to be able to best handle children's needs. But on average, the state is paying about half of what other states are paying for these positions. The American School Counselor Association recommends a ratio of one counselor per every 250 students. But right now, schools in South Carolina are lagging behind in providing for these much-needed guidance to help the state's youth.
Our ratio of counselor per student is 1 to 1,300 in South Carolina. Woefully inadequate. There are not enough resources to meet the demand.
Yeah, and of course, the big question now is going to be getting these teachers, these counselors, I should say, hired, and the funding to pay for that. We're right here in South Carolina. Richard Devane for Wake Up Charlotte.
Richard, thanks. Time